Another component of the core functions is client education. We do counseling and we do advocate, but we also have to educate the clients on the resources that are available. We also have to provide them with the information that they need to make sound decisions about their life, as well as about the treatment and aftercare for their substance use. What we really want to do is provide them with the resources to make that client independent, because a lot of times when people are in their addiction, they've lost their independence. They have lost it due to the drug use, due to the loss of resources, the loss of family support, the loss of a support network in general. And so we have to come in and try to educate the client and really work with them, because there's an old adage: if you teach a person to fish, they'll eat for a day. If you teach them to fish, they'll eat for life. It's the same thing with our clients. Our clients have substance use issues and substance use concerns, and we have to give them the skills so that they can, one, overcome the addiction, cope with whatever the pressures are or whatever the underlying causes of the addiction are, and then provide them with information on how to stay in recovery, as well as provide them with information on how to get the basic needs met. Sometimes that means going back to school and increasing your education level. Sometimes that means taking care of legal matters that may have come up during their period of addiction. Sometimes it means helping the client reconnect with a support network, whether it's family or community support, so that they can get ongoing support in their recovery. The next thing that we want to talk about as far as core functions is referrals. One of the things that we have to understand is that we will work with patients and we will work with clients depending on the setting that you're in, but we cannot meet all of the needs of the client. And we have to recognize that we cannot, and we never will be able to meet every need that a client has when they come in. There will be times when we can work with a client and do a great job, and there will be times when we can be a help for a client but may not be able to do it all. And there will be times when people will come in where we'll say, okay, this is beyond my scope of competence, and we'll have to refer a client out. And sometimes that's the best we can do, is to make a good referral for a client, to connect them with a service provider who can meet their needs. Perhaps you're at an independent practitioner and you want to work, and you have a client who comes in, but that client may need community support. They may need an ADAC. They may need to stay at ADAC, which is a alcohol and drug treatment center, or they may need an ACT team, which is a community team that really is assertive and really engages the client. I mean, the ACT teams, if someone has a dual diagnosis, a lot of times, or a really severe substance use concern, where they won't show up for meetings, but maybe the court has ordered them to get treatment, or maybe they're just out of it to the point where they really cannot make sound decisions. If you see that their level of care dictates an ACT team, which is on a higher level of care than just outpatient therapy, but not quite severe enough to require inpatient treatment, then the ACT team will follow up a person. They will follow up on a person who is in a treatment program, and they will go out to that person's house to make sure they're taking their meds. They'll go out to the house. If that person doesn't show up, they will really follow up on the client to ensure that the client has every opportunity they need to be successful in their recovery process. So that is one of the things that we must do. We have to be able to equip ourselves to make good referrals. And one of the things about making good referrals is knowing the resources that are available. As a counselor, one of the things that I do is that on my computer, I have I forgot what you call it. I have a folder. I have a folder on my computer that I save all the resources, and I catalog those resources, whether it be housing, whether it be food, whether it's in treatment, out treatment, depending on what the situation is, whether it's a family or whether it's a parent with a child. And that way, when a client comes in and the concern comes across, if I'm not sure I can address it, then I go to my list, open my folder, and say, hey, here are some choices. And this is what each service provides. This is what Freedom House provides. This is what Sunrise Housing provides. This is what Urban Ministry provides. And I just have a list of service providers. And one of the things that you'll do is you'll collect those over a period of time. You can go look them up on Google and you can find the ones that are local. But the longer you're in the field, you will learn the quality of service that each of the local resources provide. And what that does is it helps you connect the individual with the agency that's going to best meet their needs. Because just because an agency provides a service, it doesn't mean it's going to be a good fit for the client. And one of the things that we want to consider when we're making referrals is that we connect clients with service providers who not only provide quality care, but who are the best fit for the personality of the client, because we want them to have a good mix. Because if it's not a good fit, then clients won't stay. All right. The part that I think that counselors have the hardest time with is actually core function number 11. That's reports and record keeping. You hear the saying all the time, for every hour of counseling, there's 2 hours of record keeping. I'm not sure if it's quite 2 hours, but it's almost 2 hours. Because you have to do the notes, you have to do the confidentiality paperwork. Some of that's done during intake, and some of that's done during the follow-up and the referral of a client to a service provider, or doing the notes that you do in relation to the counseling settings or session that you have. You know, you've got to make sure you keep good records. Counselors are responsible for taking the notes, writing the reports, and keeping tracks of all of the clients they see. And the reason that that is important is because if a client goes to another provider, or if you retire or stop providing service, someone needs to be able to work with that client, and they shouldn't have to start from scratch. The law requires that we keep records 7 to 12 years, depending on the client's diagnosis, depending on the age of the client, depending on the service provided. And you can check with the state legislature and state laws who mandate that. You can also check with the federal guidelines in regards to how long a specific record for a specific client based on age and diagnosis and treatment needs to be kept. The final core function is consultation with other professionals in regard to client treatment and services. As I mentioned earlier, more and more we're taking the team approach. And I think that's beneficial not only for the client, but also for the counselor, because mental health and substance abuse treatment really requires a team. No one individual can do all of the work. And the other thing is that for the well-being of the counselor, and we don't talk about this a lot, I don't think we talk about it enough, especially in the substance abuse field where burnout rates are really, really high because of the work and the clientele that we work with. But the team approach is able to work with the counselor who is directly involved with the client and provide ideas on what would be beneficial for a client. They can also provide support, moral support, professional support. They become the counselor's network of support, as well as provide a wealth of information from a different set of eyes about a client diagnosis, about treatment, about how things are going. And you'd be surprised at how much more effective it is to have another professional who's working with you in your office, who has access to confidential records, who you can talk to in accordance with HIPAA guidelines to talk about a case that you're working on. One of the things that I did at my former agency was I used to do group staffings. And when we would do group staffings, a counselor would come in, bring a case, talk about the case, and then they would just sit back and get input and questions from other professionals. And that helps the professional counselor, because all this information is coming about your case and about your client. And we call it a staffing. And it allows the counselor to be able to sit back, hear various approaches, especially if a counselor is working with a client and is not seeing progress, or feels like there is no progress, and isn't sure whether it's, well, is it the client or is it me? The staffing brings out ideas that the counselor can try in order to be more effective. It also brings up different resources. Other people have resources. You aren't the only one in the office who is a counselor. You aren't the only one in the counselor or in the counseling office that has resources. You don't know it all. No one is expecting you to know it all. You're going to grow every day that you work in this profession. No one expects you to know it all. And so feel free to ask others about what's going on or what you can do to be a better service provider to someone who comes into your office. This is what the 12 core functions is all about. It ensures that clients get a high quality standard of care. It also provides an order, a process for working with substance use clients. Let me go through the 12 core functions once again. Screening, intake, orientation, assessment, counseling, case management, crisis intervention, client education, referral, reports and record keeping, and consultation with other professionals. Hopefully this is helpful, and hopefully we'll see you in the substance abuse field.